Thank you for joining us today on the program Healthy Living. I'm at Desuwa Osa Uwagie. We must sincerely apologize for coming on behind schedule because of some technical issues which have now been fixed. I'm going to be talking to my doctor today, and he is joining us via Zoom from Irua. So today we're going to look at infectious diseases. What are they? How do they come about? Management, treatment, and all of that. This is what we're going to do today on the program Healthy Living, and my guest is Dr. Joseph Okwegwali. He is the current director at the Institute of Viral and Emergent Pathogens Control and Research from Irua Specialist Teaching Hospital. He is a clinician, a researcher with interest in infectious diseases and maternal fetal medicine. He is a fellow of Lassa Fever Case Management and a lead obstetrician at the Institute of Viral Hemorrhagic Fever and Emergent Pathogens of Irua Specialist Teaching Hospital here in Nigeria. And we're so proud of him. I could go on and on and on, but that would take all of our time. It's a pleasure to have you join us today, Doctor.
Thank you very much, madam.
Okay.
Thank you.
Yes, sir.
Yes. I'm happy to be here. I'm very happy to be here, particularly now that we are faced with an outbreak of another form of infectious disease again. So I'm very happy to be speaking on this television this afternoon.
All right, tell us about this new infectious disease that just broke out now.
Okay.
Well, what is it called, and how do we recognize it?
Yeah. I hope you can hear me very well.
I can hear you perfectly.
All right, good. I want to say that Nigeria and the rest of the world has witnessed rising cases of emerging and re-emerging infectious diseases.
Sure.
You know.
Yes, we know.
We have had different kinds of diseases. Lassa fever has been here with us in 1969.
Mm-hmm.
We have had Ebola. We have had monkeypox. And recently, remember what happened 2020, 2021 when we started to battle with COVID-19.
COVID-19, sure.
So, yearly, the world is faced with an infectious disease. And oftentimes, you see that Nigeria is not spared from having the problem, from facing the problem caused by that infectious morbidity. So that's what we have every year. Currently, we are having another seasonal outbreak of disease. We usually have it like this every year.
Okay.
We could have more people coming down with it. It's usually a period of surge. We call it a period of surge.
Okay.
Usually around the period of the dry season, from about December to usually May the other year.
Hmm.
That's what we see almost every year. Last year, we had a very high outbreak, and after May, we're having very few cases. We have like 1 to 2 cases per week. You know, sometimes about 4 cases, even in a month. So November last year, when we started to have another sudden rise. At about December, we will have up to 7 patients per week. I can tell you about 2 weeks ago, about 3 weeks ago, we started having up to 20 cases. Up to 20 cases per week.
So what's this new disease called?
Not necessarily new, because Lassa fever has been here with us.
Okay.
So I will really not call it new, but we are having a higher number of people.
All right, doctor, quickly, can you tell us some of the infectious diseases we should be aware of and how to manage them, the signs and the symptoms?
All right, thank you very much. I hope you can hear me now.
I can.
Yes. Okay. I'm quickly talking about Lassa fever because we are currently in the period of outbreak, and we are having a surge in our Lassa fever isolation ward this year between January and now. We have admitted over 220 people, not just from this environment. We are having them from everywhere, from different states, you know, but over 70% of the population of people we have admitted in our ward are from Edo State. And of the
Okay, doctor. Lassa fever has been with us for so long.
From the disease, so it's important to talk.
Yes. Please go ahead. Tell us everything we need to know, because a lot of persons don't really know how to go about it, regardless of the fact that we've been talking about Lassa fever for such a long time now.
It's important to talk about it so that...
Yes. So what are the signs and symptoms we should look out for? What do we do in case of emergency?
Hello?
What are the signs and symptoms we should look out for, doctor?
It's important to talk about it because we are currently in a period of outbreak. It's a public health disease that is highly preventable. So the disease is commonly caused by rats. You know, not every rat causes Lassa fever, and there are particular species of rat which is called the Mastomys natalensis, and some studies have shown that over 90% of infections are caused by rats. You know, there are two major ways of transmission, either from the rat to the human or from human to human. The rat has a specific characteristic, so it's not the common rat you find commonly, you know, probably around your house. You know, multiply breasted rats, so many breasts on the chest of the rat, you know, with relatively hairless tail. And the major way it commonly causes the disease is when people consume some of the products that have been contaminated with excrement from the rat. How do I mean? For instance, people who dry garri along the roadside, people who dry grains on the roadside, because the rat is usually peri-domestic. It can live in the bush, it can live in the homes. So when it comes to the road and you are seeing people drying grains along the roadside, it can defecate on it. It can, you know, pass some excrement. And when people eat it like that, probably they'll be consuming some, you know, form of the viruses that will eventually cause some of these illnesses. Another way to contact the diseases is when people have contact with those who are currently infected by the virus, and that happens commonly in hospitals. That happens commonly in hospitals, and it's important for us to know that not every fever, when people complain that they have fever, not every fever is caused by malaria and typhoid. So we must understand that when we continue to treat fever, when we treat malaria, we think it's typhoid. Typhoid is not as common as people think it is in this part of the world. We must begin to think of something else. If you have taken anti-malaria for 3 days and it's not working for you, you should begin to think of something like Lassa fever. In Lassa, during Lassa fever epidemics like we are currently having, when you see people are not getting well from common febrile illness, that's what we should think about. Because the test for Lassa fever is relatively free. And when healthcare workers become more aware that, yes, I should have a high suspicion that this possibly could be Lassa fever, then there's a higher chance that that healthcare worker managing this particular person will send sample for diagnosis. Diagnosis by polymerase chain reaction, which is commonly done in designated centers in Nigeria. Ira Specialist Teaching Hospital is a center of excellence for diagnosis and case management, and of course surveillance for the disease. So most of the when samples are sent to ISH, it's done freely, free of charge, without, you know, having to pay any stipends.
Apart from,
tell people to
hello, doctor,
the samples very well, so that it has that it becomes it becomes very viable, you know, for laboratory diagnosis at the time we are receiving it in our laboratory.
Don't you think we should have other testing centers apart from IRUA? Here, let's take Edo State now, where we have prevalence of the case of Lassa fever. Don't you think IRUA is too far from a place like Benin and other areas, especially when it comes to keeping the samples safe?
Yes. I know that the Nigeria Center for Disease Control and Prevention is making efforts, you know, to see that more centers are able to make that. Like University of Benin Teaching Hospital is one of the designated centers. But most times we interact, because sometimes you could have, you know, some reagents not available and common things, but they still make diagnosis at UPTH. But being center of excellence, we have a couple of collaborators who are able to come to our aid whenever we run out of some of these materials that are needed to make some diagnosis. And the Nigeria Center for Disease Control is already making effort to see that, you know, some local arrangements are made to move some of these samples in cold chain.
Okay, Doctor, I'm sure.
And of course, that chain of communication is also established between diagnostic centers and the physicians sending these samples. So for now, we really don't have issues with that. What we currently have issues with is people trying to treat without having an index of suspicion to say, yes, at this point, I need to find a way to see whether it's something different from what I've been treating.
Yeah.
You know, people giving drug over the counter in chemist places.
Exactly. That's my point.
You know, a couple of places, and you know, people being brought into the hospital very late when they have already developed complication of the disease. At which time it becomes now very difficult for the physician to handle.
So when should a patient quickly visit? When should a patient go to the hospital now? What signs should the patient look out for before the person starts running to the hospital, instead of running to the nearby chemist and all of that? What vital signs should the patient look out for?
Close to 100% of patients will have fever. Fever, nausea, malaria, easy fatigability. You know, because this is a malaria endemic region, the very first thing people will try to do is
malaria.
To try to treat malaria.
Of course.
Malaria, and you see that you are really not getting well. You know, you now begin to have reduction in urine volume, because renal involvement can be very early with renal disease. Reduction in urine volume, when they do urinalysis, they are seeing protein in urine, they are seeing blood in urine, you are bleeding from anywhere, bleeding from orifices. These are signs that, yes, there's a high need to think of Lassa fever, and that person has to be tried and tested.
Okay, let's look at government involvement in all of this before we round up, Doctor. How much is government doing in this area?
Government is doing much. I can tell you, like in my facility, you know, apart from support for the Federal Ministry of Health and Nigeria Center for Disease Control, the state government has also been doing so much.
Okay.
You know, there's currently an isolation ward being built by the state government in our facility. It's reaching a completion stage, I know, but we still get a couple of materials from the state government to support, because a couple of patients we manage at Torapel Skin Hospital are actually patients who are indigents of the state. Many of them, in 60 to 70% of cases. So the government are actually coming in. You know, there's an Edo health insurance scheme which was recently introduced by the state government. That has been very helpful, because we actually manage people who are poor.
Yes, indigent.
This is common in people who live in slum, the poor people, very indigent patients who find it difficult to pay bills.
Okay.
So that was a major breakthrough when the Edo HIS was introduced. At some point, I think that was introduced during the last outbreak, when we had a very high surge, and we had so much to do in terms of trying to settle bill for some patients. The hospital tried to clear some bill with a couple of issues. So the state government had to come in at that time to introduce a health insurance scheme for some of these patients.
Okay, so, Doctor, thank you. Yeah, thank you.
Federal government and some of our collaborators, both locally and international collaborators.
All right, thank you so much, Doctor. I'm afraid time is now our friend. I'm hoping that we're going to do this again, and with the hope that the network will be friendlier when next we'll meet again on this platform.
Probably at the center, probably we'll have to come to the studio.
That will be fantastic. That will be fantastic. We'll make
about the concept of the disease and other infectious morbidities that we are faced with.
Okay, no problem, Dr. Okwegwale. Thank you so much for finding time to be with us on this program. We'll talk much later to see how we can actually bring you to the studio. All right, people.
All right, thank you very
much. You're welcome. This is the much we can do. We so much apologize for the wavering network nature, okay? When next we do this again, I promise you it's going to be bigger and better. We'll see you again next week. Bye-bye.